Hello, my name is Allison Cutler. I'm going to be doing a general medical exam on Amy Ramos. Thanks for letting me be your doctor today. We're going to take some vital signs. We're going to be taking blood pressure, temperature, pulse rate, respirations, ear and throat exams, lymph node check, and hearing. Next, I will be taking a blood pressure. I will be using the blood pressure cuff and a stethoscope. I place the blood pressure cuff around her humerus, and I will be locating her brachial artery, which is on the medial side of her forearm. To find it, I'm going to have her flex her arm and find the biceps tendon, and move my fingers over medially to find it. Thank you. For the stethoscope, I will be using the stethoscope where the buds are facing away from me to make sure that they fit in my ear correctly and towards the direction of the ear canal. I will place the head of the stethoscope where I found the brachial artery. And I will tighten the knob to my right to make sure that the air goes in accurately. I'm pumping air into the cuff to about 180 and releasing the air slowly. What I got was 108 over 70. Within normal limits is about 120 over 80. My first number that I got was a systolic number, which is the amount of pressure being pumped out of the heart, and my diastolic was my second number, which indicates the heart at rest. Okay, so next I will be taking your temperature. I will be using this thermometer and placing a plastic cover over the tip just to make sure we can reuse this and make sure we don't spread infection. So I will ask her to open her mouth and stick this underneath your tongue. Go ahead and close. Normal temperature is 98.6. Waiting for it to calculate. Okay, we got 94.8. As I said, 98.6 is regular. Okay, so the next exam I will be doing is a ear and throat exam. I will be using an otoscope. I'm going to make sure that the light is working. What I'm going to have her do, just sit there nicely. I'm going to pull up on her helix, and I'm going to put it in. What I'm looking for is her tympanic membrane. Normal is a grayish clear translucent color. If it is red or a yellow, it means that there's a sign of infection, and we should probably go see a doctor for that. Next one we'll be doing is for the mouth. Same thing. I'm going to have her open up and say ah. Which one did you use?
You use that side.
I'll be using a tongue depressor to move the tongue out of the way. What I'm doing is I'm looking at the tonsils and the uvula to make sure that they're normal and don't have any infection. Normal color is about pinkish. If there's any signs of white spots or anything like that, maybe a sign of infection. If the uvula is moved to one side or the other, it means that there is another sign of infection. Next I will be looking at her lymph nodes. Lymph nodes helps carry waste throughout the body, so if there is any tenderness or swelling or inflammation, it could be a sign of possible infection. So I'm going to be testing her submandibular and her anterior cervical. So I'm going to use 3 or 4 of my fingers, and I'm going to come below the mandible, feeling about. I'm feeling for any tenderness, swelling, and then I'm going to check her anterior cervical. So I'm going to come down the throat. I'm going to have her look to one side. It becomes more prominent to feel. And I'll have her look to the other side. Checking for any swelling or abnormalities. The next test I will be performing is a hearing exam. I'll be using a tuning fork that is at 512 megahertz. This test is called Weber's. So what I'm going to do is I'm going to hit the tuning fork, and I'm going to place it at the top of her head, and what I want want is if you hear it evenly on both sides or if you hear it more prominently on one side or the other. Okay?
Okay.
Do you hear this evenly?
Yes.
Okay, so which means it's a normal sign. She doesn't have any hearing impairments. If it were that one side was more prominent than the other, the ringing, it would be a sign of an auditory deficit. The final two tests that I'm going to be taking are her respirations and her pulse rate. I don't want to tell my patient that I am taking her respirations because it might alter her breathing and I want to get a more accurate reading. So what I'm going to do is I'm going to place my left arm on her upper arm and I'm going to pretend like I'm taking a pulse. What I'm going to do is I'm going to typically, it's lasts for a minute taking respirations. I'm looking at her chest rising. Within normal limits are about 15 to 20 respirations per minute. So I'm going to what I'm looking at is her chest rising and falling, and that counts as one respiration. Good, I got about 12 respirations for 30 seconds, so in this case I can double it and get 24. Okay, next I will be taking her pulse rate. So I'm going to find the radial artery, and I'm using 3 fingers coming to the lateral side of your forearm, and I will be testing this for 30 seconds as well and doubling it at the very end. A normal pulse would be 60 to 100 beats per minute. Good, I got about 28, so that make it 56, which is a little bit normal. Thank you for watching my video. Thank you, Amy, for being my patient. I hope this helps conduct a general medical exam, and I hope that this will help anyone in the future.